I'm Nicole Crawford, and this is Tiana Crawford. And she's 13 years old, and we live in a small regional town called Balla. Very. Well, I think music is one of your biggest loves, isn't it? Yeah, you love listening to music. Ed Sheeran's our favourite, isn't he? Yeah, we all enjoy going away on holidays. And we've just come back from Fiji. Tiana has spastic quadriplegic cerebral palsy. Tiana is also non-verbal, although she's verbalising a lot at the moment. Aren't you? Do you want to answer all the questions? Tiana's diagnosis of cerebral palsy has had a huge impact on our daily lives. It can be pretty full on, like it's 24-hour care. Yeah, I guess it's just important that we remember that's only part of who she is. A small part, isn't it? I feel like Tiana's disability has really not only brought our family, together, but also the community, because the community has been amazing. It really has. So she just brings people together. Once you see her smile, you cannot not smile with her. We are definitely open to talking about Tiana's disability, having cerebral palsy. We'll get the elephant out of the room, let's talk about it. Then they can show their children and teach their children, and it's the beginning of a change. So the most common assumption people make about Tiana is that she doesn't understand what you're saying. She's non-verbal, she's unable to communicate verbally, but as you've seen today, she loves a chat and to vocalise. She understands. She has trouble communicating back to us, and really I find that's our problem, not hers. So Tiana's cerebral palsy is, obviously, there's a physical component. So when we are in hospital, there's another layer of things to consider. The major one being lifting. So Tiana's close to 40 kilos, which is well over the 20 kilo recommended lifting weight. That plays a real, difficult task when we're in hospital, because there's not always a hoist around, or if there is, it's in a different unit. Generally, we're able to find a solution to most of the challenges. I think the key is definitely having that open communication with all the staff involved, and allowing that time to be able to settle in and not just rush. So we've had lots of positive experiences in the hospital setting. One that really jumps out for me is quite recently, when I did realise that I can't do it all on my own. Yeah, I just felt really supported. One of the physios sort of reached out and said, like I had mentioned to her, that each time we come to Sydney, we feel very much like a number, and in, out, and she had said to me that, please give us feedback. So that was a big one for me, because feedback kind of feels like you're whinging. Yeah, it was really nice for her to take that time and to recognise that it's tough. She said, because if we don't know, we aren't able to make changes. So yeah, that was really positive for me, because I felt like, okay, it's not just me. If I had any tips or advice for health staff in the hospital, would just be to remember that we're all people. Yes, Tiana has cerebral palsy. Yes, she's non-verbal, but she's a little 13-year-old girl. Yeah, I guess just treating everyone like they're a person, not a number. And communication, really. Ask questions. If you're not sure, just ask. And she will tell you with a smile whether she agrees or not, won't you? And treat each other like they're your mum or your sister. or your daughter.